Well, good morning and welcome to the Megacast. All right, good morning and welcome to, welcome to the Megacast. Sounds like an echo, Tyler, a little echo here in our studio.
Oh, just a tiny bit.
Echo. Good morning, good day. Thank you for joining us. Dave Scott here in the Lakes FM studio. What's ringing? That's your cell phone.
That was me.
Would you put your phone on mute?
I put it on mute and then just didn't listen to me, Dave. It's insubordinate.
All right, let's start again. I don't want to say good morning either because this is going to repeat all day.
Oh, it will.
So if I give you a good fresh start, will it be good for the replays?
Let's go with good day.
Welcome to the Megacast. Dave Scott, Tyler Keefe in our Lakes FM studio. And we are here on Lakes FM, 89.3 FM across the Greater West Bloomfield area. Civic Center TV as well. Civic Center TV, Channel 15, Channel 99 on Comcast. On all of our online editions, of course, lakesfm.com. You can listen to the broadcast there. And then on civiccentertv.com, where you can see us in beautiful high definition. So we will be here for the next couple of hours. We thank you so much for tuning in today. Every day on the show will have a special partner, and it is our Facebook partner. And Tyler, our Facebook partner today, and get your bright smiley face on TV here. Our Facebook partner today is a Greater West Bloomfield Chamber of Commerce.
It is. They're joining us today. We had Suzanne on with us, of course, on Friday. We're going to have her on again today. And the business community in Greater West Bloomfield is very hard at work during this process, during this time, and we're glad to help them out as much as possible.
All right, so the Megacast, if you're just joining us and you don't know what the heck a Megacast is, it's all these different entities live together doing everything we can to reach everyone in the Greater West Bloomfield area. So online, on the radio live, on TV, on cable TV live, and with you through all of our other outlets. So over the next several hours and throughout the entire day, we have an awful lot to get done. First of all, for those of you listening to us live, Governor Gretchen Whitmer is going to be making the big news today. We will carry her press conference at 11 a.m. Eastern Time live. For those of you that are listening to this later on in the day, you'll hear a repeat of the entire press conference. That's kind of what we do here at Civic Center TV. We open up government. Lots of rumors in the media today that she is going to be announcing further closure of Michigan businesses, non-essential businesses. That's a rumor, but it's highly expected that that's what the governor is going to say. That's going to have a lot of impact on us here in West Bloomfield. And as today, our Facebook partner here is the Greater West Bloomfield Chamber of Commerce, Suzanne Levine. We'll get to her in a couple of minutes, and we'll set up and talk about what the governor might say today. And then after the governor is done, Suzanne will join us again, and we'll talk about the impact that we believe this is all going to have on West Bloomfield. But Tyler, it's going to be another tough day as more restrictions are put on our day-to-day activities, all in the hope that fewer people get infected and we flatten the curve.
It's exactly what you said, all in the hope that fewer people get infected. We have had a significant rise in the number of cases and several deaths in the state of Michigan, particularly in southeastern Michigan, over the last several days. And so this reported announcement from the governor to come at 11 o'clock today is a precaution that other states have taken that have helped to dramatically reduce the exponential growth of COVID-19 cases.
Well, we don't. I think, in all fairness, we don't know that, but it's presumed that it will help. And our neighboring states, Illinois, Ohio, and then the big states that are really affected have all made this proclamation. Governor Whitmer was on all of the national television networks over the weekend, and she was beat up a little bit by the national commentators as to why Michigan hasn't done what our neighboring states have. So she was under a lot of pressure, and I'm sure we'll hear from her at 11 o'clock. Suzanne, again, will be with us. Suzanne Levine, the executive director of the Greater West Bloomfield Chamber. We'll check in with her. We'll also check in with our chief of police in West Bloomfield, Chief Mike Patton. We'll find out what's going on from a law enforcement standpoint, and the chief is out there. We have a West Bloomfield Township board meeting going on tonight. We'll get prepared for that. That will be the first ever in the history of our community Township board meeting today, conducted by Zoom, and we'll be using our Motown Digital, Lakes FM, Civic Center TV Zoom technology for that today. And like every day around here, we have our own Larry Nyland, who is hard at work putting together our show. And let's see if we can bring Larry in now via Zoom. Larry, are you there? Chamber will check in with her.
How's it going there,
we'll also
guys?
check in. I'm hearing an audio loop for some reason coming from Larry. Let's see if one of you guys has your TV turned up, and let's try that again. We have a West Bloomfield Township board meeting going on tonight. All right, so we're going to have to find out why. I know what's going on. I can fix that. Hang on. Okay. There we go. We got it fixed. So, Larry Nyland, how you doing today?
Good morning. Yes, a beautiful, typical March 23rd, snowy blizzard day here in Michigan.
Nothing's typical about this, Larry.
So Larry Nyland is the producer of the show today and every day. Larry's the guy putting all the details together. Larry, good to have you with us on Zoom, working from your home, as many of us are. So today we're kind of juggling things a little bit, but of course we got the governor at 11. We're going to carry that. And for the people that are listening to this later on in the day, you'll hear the whole thing. It's coming up, hasn't happened yet. So we got the governor. We've already said Suzanne is standing by. We're going to talk to Chief Patton. Have you confirmed that?
We are still working on that. We may have to adjust things a little bit. He's just got a lot going on with the snow and with the coronavirus situation going on. So that's still to be determined, but I'll let you guys know.
Okay. And then I love what you've done for later on in the program today. Hopefully we'll be able to do it. West Bloomfield musician Steve Acho will join us. And Steve, Larry, he's doing a live concert, a Zoom concert tonight.
Yeah, that's on his Facebook page, Facebook Live at 6:30 p.m. He's doing a Zoom concert for everybody. So, yeah, that should be good. He's done a lot for the community. We've seen him in a lot. Last place I think we saw him, he was in the dunk tank over at the
food truck.
Yeah. The West Bloomfield food truck rally. Yeah. You do realize you got to tell Steve. You got to tell Steve though, Tyler, that he's competing with the township board meeting tonight. So I don't know whether people will want to tune in to Steve's concert on Facebook or the township board meeting. One of the two.
Well, you know what? There's always a Facebook archive on pages. So you know if you miss Steve's concert for the township board meeting, you can always watch it back.
All right. So
we encourage you to.
There you go, Larry. You washing your hands okay?
Oh, all good. Always.
Good.
Okay.
They look clean.
No way I would not have washed my hands before I'm drinking or eating anything.
All right. Anything else our Megacast viewers need to know?
We're going to try to, as we've been grabbing lunch every day, we're going to try to grab lunch today at the beautiful Lodge Restaurant and Bar in Kego Harbor, right there on Orchard Lake Road. So if you guys can get a menu out and try to find an order for that, that'd be good.
All right. So we have a new. Could we go get Jeff? Go bring Jeff in here. I'll get out the disinfectant wipes. He doesn't really know the routine yet. We're gonna bring Jeff in from our staff. Jeff's going to be the new food guy, and he's going to be the manager of the Carryout Club. So if you don't know what the Carryout Club is, here's the way this is going to work. We are getting together with restaurants across West Bloomfield, and we're going to promote them and remind you that we really want you to do everything you can to support these restaurants during these really difficult times. So the Carryout Club is an invitation for you to go to our website, check out the restaurants across West Bloomfield that are participating with us, and then give them a call. And a lot of them will have curbside dining. A lot of them will have delivery. Larry, I know you're really careful about the way you manage things at your home. My guess is you would be one of the guys, Larry Nyland, our producer on Zoom, you would be one of the guys that would say, you could just drop off my food at the door and ring the doorbell and I'll come get it.
It will probably sit there. I will be honest with you, even though I know the restaurants and everyone is taking a lot of precautions, if I get anything from out, I kind of leave it in the car for a few hours and then go back in and get it, reheat it myself. So you never can be too safe in these
Larry, I heard that the Lodge, we got to run, but I heard that the Lodge actually ran out of food last week, that their carryout business was doing so well. I don't know if that's true or not, but I heard that rumor.
That is what happened. So that's why we're going to try to get in there. They open at 11 today, so we're trying to get in there a little earlier, get that order, and make sure we get some lunch before before they run out.
All right, the Lodge in Keego Harbor, one of our Carryout Club restaurants. Larry, thank you very much. We'll check in with you soon. Joining us in the studio now is the Carryout Club manager, Jeff. Hey, Jeff, how you doing?
Good morning. How you doing?
Good.
Doing
You got great radio pipes. I'm sorry.
Thank you. Yeah.
We haven't had you in the studio yet.
This
Good to
is
have
the
you
first
with us.
time.
Now, welcome to our studio. Could you please confirm to our audience that you are, in fact, sitting 6 feet away from me?
I am, in fact, sitting 6 feet away from you. I'm a big guy, though, so that kind of closes the distance, I think, a little bit.
So there's the disinfectant wipes. You might want to wipe that microphone down a little bit while I explain what's going on. Tyler was
Safety
in
first.
here. Yeah, just, we try to do the best we can to keep it safe here in the studio. So the Carryout Club, the way it's working is all you need to do is get a hold of Jeff. And Jeff, your email is Jeff at MotownDigital.com.
Jeff
right?
with a G. Geoff.
All right. You can send email to Jeff, Geoff, and maybe we can get Adam to put a contact form up on the website so people can do that. You can also call us at 248-683-2343 and let us know that your restaurant wants to participate in the Carryout Club. Then what Jeff is going to do, if you up for this, Jeff?
I'm up. I'm
All
up for it, yeah.
What Jeff is going to do, he's going to get on our website, and Jeff will enter all the information for all the restaurants in West Bloomfield that are participating. And then all you need to do is go to civiccentertv.com/carryout, and you'll have all the information there. We're making some posters today. We're going to get them printed over at the UPS store in West Bloomfield, and I talked to them. They say they are an emergency business here. They would not get shut down if the governor shuts down businesses today, so you'll still be able to mail and print. That's good to know. But Jeff, so tall order. You're going to keep that website up to date, get all the restaurants. You're going to call as many of the restaurants as we can and just let them know what we're doing and see if we can get them involved.
Yeah, that's right, Dave. I'm going to be reaching out to people, reach out back to us, too, and we're going to try to build this up and promote local businesses and restaurants and have some fun eating some food, too.
All right. Do you mind running down to the Lodge today and getting carryout for the crew?
No, that sounds good to me, too.
Okay.
Yeah, so.
And then Ryan will show you how to work the radio gear.
All right.
So you can take the radio broadcast with you, and we'll get an update. So Jeff is the new guy working on that. We'll check in with him in a couple of minutes. And our own Danny Mann from Civic Center TV is going to give us a helping hand. And Danny is working on some new artwork for the website. Hopefully we'll have that in posters today, and we'll be able to get all this going. We're going to take a quick break. We'll be back in a couple of moments, and we will check in with Suzanne Levine. She is the Executive Director of the Greater West Bloomfield Chamber of Commerce, and Suzanne will bring us up to date on exactly what is going on in the business community. We'll talk quickly more about the Carryout Club and get ready for Governor Whitmer's press conference coming up in just a bit. You are listening to 89.3 Lakes FM, lakesfm.com, watching us on Civic Center TV, Channel 15, Channel 99, and our Facebook partner today is the West Bloomfield Chamber of Commerce. We thank them for participating and putting us on Facebook. We'll be back in just a moment.
When is the best time to talk to your family about staying in touch during a disaster? When floodwaters reach your door? When wildfires are engulfing the edge of your neighborhood? Or an earthquake is destroying buildings? Or is the best time perhaps today? During a disaster, you may not be able to stay in touch with your family or friends as easily as you think. Go to ready.gov/communicate and make your emergency plan today. Don't wait. Communicate. Brought to you by FEMA and the Ad Council.
The need for blood is constant, and sometimes that need becomes critical. From accident victims and cancer patients to premature babies and those with blood disorders, hospital patients rely on all of us to make sure that blood is on the shelves and ready to help. That's why the American Red Cross needs you. Make an appointment to give blood today by calling 1-800-RED-CROSS or visit redcrossblood.org. Your one blood donation can save up to 3 lives. This has been a public service announcement from the American Red Cross and 89.3 WBLD, the all-new Lakes FM.
Each of us have a role to play in stopping the spread of COVID-19. Keeping a distance of at least 6 feet
will slow the community spread of COVID-19. I can help.
I can help.
I can help by washing my hands.
Using warm water and soap for 20 seconds.
And drying my hands with paper towel multiple times throughout the day.
Be sure to cover your cough using your elbow.
In an effort to prevent the spread of COVID-19.
Avoid touching your eyes, mouth, and nose.
Not feeling well? Have a fever? A cough? Do your part and stay home until you are well again.
If your symptoms are more significant, call your doctor.
Don't drive to the emergency room or show up at your doctor's office.
Without an appointment, that can spread the virus.
In addition to social distancing, avoid crowds.
Even small groups of people can increase the risk of spreading COVID-19.
We know it's hard, but we all need to do our part to stop the spread.
You can get outside and enjoy the parks. There are plenty of trails that are open.
And provide plenty of space for social distancing.
You can call, text, or
chat with friends and loved ones. Hi, Grandma.
You can put together a puzzle.
Or start your spring cleanup.
Or just catch up on Netflix.
We can all do our part to stop the spread of COVID-19.
Welcome back to the Megacast right here in 89.3 Lakes FM, lakesfm.com, Civic Center TV, civiccentertv.com. And, of course, today we thank so much our strategic partner, the Greater West Bloomfield Chamber of Commerce, who has opened up their Facebook page, and we are streaming live on Facebook right there. Joining us now from the Chamber is Suzanne Levine. She is the Executive Director of the Greater West Bloomfield Chamber. Suzanne, good morning, and I think I got you in here. Welcome to the Megacast.
Good morning.
So thank you for joining us. Wow, big day today in that the governor in a little bit, in about a half an hour or more, is going to have a major announcement for the state of Michigan. A lot of the media outlets are suggesting that today that likely is going to be further business closures here in our state. Your thoughts?
Well, I think as much as most of us are not happy about it, I think it's something that is needed. If people aren't listening and exposing themselves, their parents, their grandparents, I think then unfortunately they're going to have, you know, the gavel come down hard and basically say, no more, you have to listen.
Well, we hope it will start to flatten the curve. Later on today, we'll go through all of our terms that we have here. We've got a daily sheet that we put together with the vocabulary of the coronavirus. Flatten the curve is a big one of them, and we're trying to just limit the number of people that get sick, and that's why we are continuing to close down more. But it does certainly create a hardship on our businesses. And have you talked to the West Bloomfield area businesses to get any feedback for how they're doing right now?
Yes, I have, and I know everyone's trying to kind of reinvent how they do business today, and I'm certainly trying to work with them as we're a strategic partner, trying to figure out, for example, the real estate agent can, virtually show a home, and someone can virtually see it. Also, like our therapists, how they're available, via Zoom or other methods, Facebook, etc., because we know that we really need to get some extra help during this very stressful times.
Well, there's no question. So, I know it's tough. We're doing what we can here to make it as easy as possible for people to get through this crisis. We've been talking a little bit here this morning about our Carryout Club, and we're putting that in full implementation today. You can see the website right now. If you're on civiccentertv.com and you're watching us on TV, we have the website up, and we're going to work on some new art. Remember our own Danny Mann? Remember Danny Mann, anybody? She's working on
yes, how is she?
She's doing great. She's working on art for us right now. These are wonderful pieces of art, but we'll have that updated. And you can see right now we have started by listing participating restaurants. There's the Stage Deli with a link to their website and their menu. We're going to be heading out today to go to the Lodge in Kego to get our lunch and do our carry out there. So we're just encouraging every restaurant in the area to connect with Jeff, and hopefully that will help. And just whatever we can do to get people to continue to go to the businesses that are open, I think is a good thing.
Absolutely, and I know that I've been trying to encourage people if they can carry out or even buy gift cards, so that eventually when this tsunami does pass, that that these businesses can survive. So that's a lot of us go to these businesses and ask for donations for a lot of our fundraisers. So now it's time to try to figure out a way to give back to them by supporting them with gift cards and even I've reached out to some of our retail establishments. Maybe there's a way for them to take videos of their merchandise and put it on Facebook and say, if there's something you want, then we'll even deliver it to your house. That sort of thing. Trying to figure out ways to reinvent business so that they're able to stay open and reopen when the time comes.
Well, I think everyone's doing everything they can to keep promoting business and interacting with business to the extent that it's safe. And then there are the other things that are going on. So I can share an experience I had over the weekend operating my small business. I did get an email from the Small Business Administration office here in Michigan, and they had a webcast over the weekend and a Zoom meeting, as a matter of fact. And there were, 50, 75 businesses on the call I was on with the SBA office, and they are beginning to deploy, and I can tell you right from the front line because I'm working on it myself, they're beginning to deploy disaster loans, the kind of loans that you would get if a hurricane or a tornado ripped through your area. This health crisis is just as devastating to business, if not more, than one of these other natural disasters. So they already have a loan program out. And Suzanne, I thought it was pretty cool. They have a $25,000 unsecured loan that you can apply for, and then you can apply for up to $2 million of money if you're willing to put your house or something up. So, we're going to have to do that to keep our employees going and active. I don't want to lay off any employees we don't have to. And as of yet, we've laid off nobody. So, that's the idea. Keep everybody working, keep payroll going. And, and then hopefully we'll get some help from the government. I know there have been unemployment programs set up by the state of Michigan. We'll get some links on our coronavirus website today, but there's state of Michigan unemployment programs, and we know and maybe it's been worked out by now, we know there's a big effort on the federal level in the legislature to create even more programs to get checks to every American and to help out businesses. So some of these programs are getting implemented. Hopefully they can get implemented quick and bring some relief and keep some of us employed, because I think this thing, if and when it settles down, and it will, we want to be able to be there to ramp back up quickly too.
Right, and I know that we sent out an e-blast that had links to the Small Business Administration disaster programs. There's and also the U.S. Chamber resources, the coronavirus resource website, the disaster help desk, resources to help your small business survive. I know Oakland County is trying to do their bit and send out information as it becomes available. And hopefully our Congress can get it together and pass this and not play politics. I know that there's been a holdup in Congress with some of the money. So I think everyone needs to urge our senators and representatives, regardless of their political affiliation, this is not the time to take credit or point blame. It's the time to come together and really help the people that are suffering.
Now, no question about it. Well said. So, Suzanne, I appreciate you taking time for us this morning. I'm going to let you go because I know you got some other stuff to do, and I'd like you to listen to the governor's press conference at 11, and then we'll check back in with you and see if we can get some feedback from you on that.
Okay, that's great.
All right. She is Suzanne Levine. She is the executive director of the Greater West Bloomfield Chamber of Commerce, joining us here. We're working together again. There's the Carryout Club website. It will be improved today, but it's coming along. We got some participants in there, Stage Deli already and others. So go to civiccenter.com/carryout to find out more about that. Tyler, I know your team is working real hard on getting the coronavirus page updated. We're building a new page for the Megacast, and hopefully we'll have all that online before the day is over.
Yeah, we are working to make CivicCenterTV.com your go-to one-stop home for information on coronavirus in Greater West Bloomfield. As we are on the radio and on TV, we're going to give you an online resource as well that will lead you to the information we bring to you on this program every morning, any updates from emergency services in town, as well as access to things like the Carryout Club that help our businesses in the community.
Well said, Tyler Keefe. So we're going to make history. You know, we're in the business here at Civic Center TV and Lakes FM of providing, under normal circumstances, coverage of meetings and major political events. So you've been doing a good job. I noticed in watching Civic Center TV over the weekend that we had the Keego Harbor meeting via Zoom last week. We had West Bloomfield's meeting happen normally, and then the Oakland County Board of Commissioners, we broadcast their meetings also via Zoom, and we'll continue to do that. Today we make history in West Bloomfield, the first ever interactive meeting in the history of the township with the new rules put in place by Governor Whitmer last week.
And additionally, the school district, too. So both of our channels it'll be the first time we'll be running multiple meetings on multiple channels via Zoom. WBTV, the West Bloomfield School District channel, of course, at 7 p.m. will have the school board meeting also via Zoom.
Okay, and I know this is going to repeat, so if you're hearing this in the evening or Tuesday morning, be aware that it happened. And like everything else we do, all of our archives of everything, this show, everything, is always available at civiccentertv.com, and your team's doing a really good job getting all that information up to date. You guys are uploading videos like crazy over there.
Oh, we have lots of content to upload, and it's important information to upload, so that's always why we do it.
All right, so West Bloomfield Township Board meeting Zoom tonight on Civic Center TV. West Bloomfield School District Board meeting tonight on WBTV Channel 19, and we'll use a radio too. So if the Township Board meeting ends earlier than the school board meeting, we can pick up the other half of the school board meeting on Civic Center TV and radio, right?
Correct.
Can we do all that?
Yes.
Okay, great. Otherwise, you'll hear the Township Board on the radio and then see it on Civic Center TV. So we are waiting for our Chief Police, Mike Patton, to check in. He is, as I understand it, busy in the field right now taking care of some things, and I imagine with the weather that's going on there, in addition to the regular stuff, they're very busy. We will hear from the governor. We're trying to check in with others here. We'll get to some other folks. We're going to be participating with our carryout partner, the Lodge, today. That's where our lunch is going to come from, and we can add them as another member of the Carryout Club. So really excited about that.
Yeah, they were very excited. Larry was telling me over the phone this weekend when he said the Lodge was in for this, that they are very excited about joining us for this. They love this idea, and I hope that the rest of the business community in the restaurants in our community are as excited as this. This is a great way for us to partner with them.
All right. So, and one other thing, a phenomena that's seeming to get more popular by the second is musicians entertaining on their Facebook pages live. I've been seeing a lot of that happening, and our own Steve Acho, West Bloomfield's own Steve Acho, is going to be doing just that tonight at 6:30, right in the middle of our meeting coverage.
Right in the middle of our meeting, unfortunately. So we won't be able to enjoy it until after. Of course, we'll definitely watch the archives. He's fantastic. He's been on with us before on the Splash. He performed. He was the first person to perform, to my knowledge, to perform music at the West Bloomfield Township Board meeting before, and he did that right before. He, of course, was one of the headlining performers at last year's food truck rally.
So we have Steve lined up for the tail end of the program today. I don't know how long Governor Whitmer is going to go. Hopefully we'll get him in. If we have to, we'll do it tomorrow. But he's standing by at home right now and all connected to Zoom, and hopefully he's going to get his guitar and maybe do a song for us.
Yeah, that would be fantastic. He does a lot of covers. He does some of his own original music too, and he's very, very good, Dave.
I can't play it on the radio or on TV because we don't have the copyright rights, and if we play any music right now, we'll get knocked off Facebook. But I heard the greatest thing on the radio today. It was Neil Diamond himself doing kind of a parody of his own song acoustically, doing his own version of Sweet Caroline, and right where it sings hands, holding hands or touching hands, da 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 da.
Yeah.
It says hands, washing hands. So I thought that was kind of cute. See, nice. Everyone's getting involved trying to help and send a
Everyone's
positive
doing their part. It's
along.
great.
All right, I was just handed a note. Chief Flynn, the chief of the fire department in West Bloomfield, will join us in about 5 or 10 minutes or so via Zoom. We'll check in with him, and much more coming up. So let's take a quick break, and don't forget West Bloomfield Township Board and the West Bloomfield Schools meetings live tonight. More on what's going on all across our community right here. Don't go away. I'm Dave Scott. He is Tyler Keefe, and we're here in the Lakes FM studio on the big Megacast on Civic Center TV, on the West Bloomfield Chamber of Commerce Facebook page, and of course right here on CivicCenterTV.com or on LakesFM.com and 89.3 WBLD Lakes FM. We'll be right back.
Is that a faucet running?
That's not a faucet. That's a river rushing through the forest. Forest rivers provide over 100 million people with clean water to drink.
What? I can't hear you because of the vacuum.
That's not a vacuum. That's the trees in the forest cleaning up the air we breathe.
I didn't know the trees were so amazing.
Yep, and the forest gives us shade, trees to climb.
That's awesome. Let's go explore some more.
Visit the forest today and enjoy all it does, just for you. To learn more about the forest and find one near you, go to discovertheforest.org. Brought to you by the U.S. Forest Service and the Ad Council.
The Cloud Learning Initiative launched on March 16th. The meal service program is kicking off for cloud learners. Pre-order forms and information about weekly menus can be found at www.wbsd.org/mealservice. Pre-order forms must be submitted by 3 p.m. and at the latest the day before. The meal service is open to any family, regardless of city residency, and any child from birth to 18 years of age. Please visit www.wbsd.org/mealservice.
Hi, I'm Britney Spears. I've had the pleasure of singing all over this great nation, but today I'm lending my voice to the 15 million kids in America struggling with hunger. Every year, billions of pounds of excess food go to waste, while 1 in 5 children may be left without enough food for a meal. But it doesn't have to be this way. That's why the Feeding America nationwide network of food banks helps to get food to families in need. Visit feedingamerica.org to learn how you can help. Together we can solve hunger. Together we're feeding America.
Brought to you by Feeding America and the Ad Council.
It's Thursday night, and you're grabbing drinks with some friends. Started off with a pitcher for the table, which quickly becomes 2. There's pool. And there's the photo booth.
All right, everybody squeeze in. Say cheese!
Followed naturally by an order of wings. And another.
Can we get some extra ranch sauce?
Then there's the ceremonial nightcap.
So what are we doing this weekend?
And lastly, it's back to the car, which, if you're buzzed, could be the most expensive night of your life. Getting pulled over for buzzed driving could cost you around $10,000 in fines, legal fees, and increased insurance rates. Nothing kills a buzz like getting pulled over for buzzed driving, because buzzed driving is drunk driving. Brought to you by the National Highway Traffic Safety Administration and the Ad Council.
All right, welcome back to the Megacast right here on 89.3 Lakes FM, lakesfm.com, Civic Center TV, and CivicCenterTV.com. And our partner today in the Megacast is the Greater West Bloomfield Chamber of Commerce. And we thank Suzanne Levine for making her Facebook page available for us here today. Don't forget, we have Governor Whitmer at 11 o'clock, and media outlets all across Metro Detroit are saying that during the press conference, which we'll have live for you here, that she's going to put further restrictions on businesses here in Michigan. We'll find out more about that. Larry Nyland, I know you're right there. Could you turn your microphone on for just a second? I want to check in with you here real quickly. Let me hit one other button here, and there you go, Larry. Are you with us, Larry? Our show producer.
I'm with you.
All right,
Our
show producer, Larry Nyland, with us on Zoom. So the lodge in Keego Harbor went to dinner hours, so we're not doing lunch with them. Do we have somebody else we're going to do lunch with today?
Yes, we have Leo's Coney Island that's on Orchard Lake Road near 14 Mile, right next to Kohl's there. We're going to contact Mo, and so if we can get an order ready for that, they are ready for our phone call.
Excellent. Chili. No beans for Dave Scott. No beans in this little studio here. All right, thank you.
No beans.
No beans. Thank you, Larry. Kill your mic, please.
Get some chili fries.
We'll get some chili. Yeah, that's definitely not on my diet, but thank you very much. Let's check in now via Zoom with Dr. Melanie Schwartz. She is a psychologist, I believe, here in the West Bloomfield area. Dr. Schwartz, can you hear me, and are you with us?
I can hear you. Can you hear me?
I can hear you, and I can see you. Thank you very much for joining us here on the Megacast. I really appreciate it.
Sure. of course.
Well, so tell us a little bit about yourself for people that don't know you. And if you can just we're going to do this live on the radio, just tilt your computer screen down a little bit so we can see you. There you go. That's perfect. And you got to speak up real loud because it's a little hard to hear you. But so tell us about you, your practice, where you're at right now, just a little background.
Okay. Well, I am a clinical psychologist, and I own Viewpoint Psychology and Wellness. We have 2 locations as a private practice, one in Commerce Township and one in West Bloomfield off of Orchard Lake and Maple. And we, our group sees all ages, basically from age 3 to 103. Most of us right now are using teletherapy as opposed to in-person therapy, which is somewhat new for us, but we are adjusting well to it. And we also, in our practice, we have nurse practitioners who can prescribe medications, and we also have a neuropsychologist who does testing for ADHD, learning disabilities, giftedness, things like that.
So, Dr. Schwartz, clearly most of the attention lately has been on the coronavirus and the physical impact that it's having on our bodies and the spread of that and all the danger associated with that. But talk about what's going on in your practice and the challenges that people are having dealing with this entire crisis.
Well, there's a variety of things going on right now. Obviously, anxiety is a huge piece to what's going on, anxiety and stress, because this is unknown. And we are a society that likes predictability, and we don't have any of that right now. And if you watch the news, if you listen to the radio, if you're on Facebook, we're hearing a lot of negative news. We're not hearing a whole lot of positive, which increases people's anxiety. People are not used to being able to go out, or people are used to being able to go out and do the things that they enjoy doing, go to work. All these things that we have kind of taken for granted have been taken away from us momentarily so that we can be safe. So all of that is creating anxiety. Being home with your family for basically 24/7 is new to a lot of us.
You're not kidding. That might be the hardest part of the whole thing. You know, I mean, these are the people we love, but we don't normally spend that much time together. You spend, a week with your spouse, you might be ready to kill each other, and in that period of time. We just naturally need a little space from each other.
We do need space from each other, absolutely, and those of us with children or young children are having a hard time getting that space right now. A lot of people will go to work to get that space, or go out with their friends, or their kids go to school. None of that is happening right now. Also, the whole piece of parents having to homeschool their children, that's creating a lot of anxiety. I'm also starting to deal with some of the depression that's coming from this, such as feelings of hopelessness, because they think this is going to go on forever, that it's always going to be this way. It's not going to change. They can't see the other side of things right now. So we're seeing a little bit of everything going on, mainly anxiety. That's what's coming out. The kids that I've been working with this week have reported a lot of boredom.
Imagine that. Hey, listen, we only got a couple of more minutes. I want to ask you one question, and then can we keep in touch with you and have you on frequently during this crisis?
Sure, absolutely.
Well, we appreciate you taking time. So we know what we need to do to help our bodies physically. We need to get sleep. We need to isolate. We need 6 feet. We need to wash our hands. You have a couple of tips for what we can do to make sure that mentally we are where we want to be, and if people are having a challenge, what's the washing our hands equivalent, if there is one?
Go outside, get some vitamin D. Okay, we're staying inside the house when this is a perfect day for the kids to go outside and play in the snow. Okay, if you're not around people, it's perfectly okay to do that. Make sure that you are getting time for yourself. Even if you say, I need 5 minutes, lock yourself in your bedroom for 5 minutes, and ask your spouse, if you have one, to watch the kids. Something that we're suggesting is kind of keeping a routine, a schedule, to kind of decrease the anxiety, so that the kids know how to predict what's coming next, because they don't as well. We don't need to keep the kids occupied at all times, but kind of keep them on a schedule, as well as meditating, if you can do that, or mindfulness, taking a few minutes to just kind of sit there with yourself, do some deep breathing. These are the things that are going to help us right now and get us through this. Okay. And self-care, whatever that looks like, it's different for everybody. But if it's just sitting down and binge watching TV, then that's your self-care.
Yeah, I did. I watched a couple of great movies on my Apple TV yesterday, and I knew I couldn't go to the theater, but that was great. It worked for me. So you got to do whatever you can do. Hey, can I ask you a favor? Can you make one more prescription to your patients that I think might be helpful? Now, this is going to be a little self-serving, but I would recommend that they all tune in to the Megacast. So you're cracking up. I love it. But why not? It just, can stay connected, get involved, see other people are going through the same thing that they're going through. Maybe, we can't connect directly, but whether you connect through the Megacast or, families that you can't be with connect through Zoom or some other tools, that's got to be helpful too.
Yes, it is. And people are doing that. In fact, more so than ever, I think, through Zoom or through FaceTime or whatever other platform they're choosing to use. So that's great. And that's important. And also be talking about how you're feeling. That's also very important right now.
All right. Well, I'm feeling very fortunate to have you on our broadcast. Thank you very much. I appreciate you taking time. She is Dr. Melanie Schwartz. And if you don't mind, we'll keep in touch with you.
Sounds great.
All right. Dr. Melanie Schwartz joining us right now on the Megacast. We're going to shift gears and head over to fire station number 5. And joining us right now is Greg Flynn, the West Bloomfield Fire Department Chief. Flynn, how are you doing today, and how's everything over at fire station number 5?
Good morning, Dave. Things are going well. We continue to do all of the same things that we're asking everybody else in the community to do, as the firefighters and paramedics here are keeping their social distancing, and we continue to respond to the growing needs of symptomatic residents in the township with COVID-19 signs and symptoms.
I was talking to Dr. Schwartz there for a couple of moments just before you came on, and worried about people that are at home. But this has to be stressful for your team and all the other employees in West Bloomfield, whether they're first responders or otherwise. How are they holding up?
What a great guest to have on. I caught the last few minutes and really support what she was talking about. What a great advocate for emotional wellness, something that we continue to focus on in the fire service and emergency services in general and public safety, but even more so now. There is an additional level of stress, clearly, Dave. I mean, the paramedics here, the firefighters, the police officers, our dispatchers, everybody who's engaging with the public, they're all nervous about the job kind of at times goes home with them. And this is something you don't want to take home to your family. And I know for myself, my family's practicing shelter in place. And who's the one person who is leaving on a daily basis and coming back home? It's me. So I'm the weak link in that family responsibility. So I have to take additional precautions because I'm the one person that's coming in from the outside. So I take that responsibility very seriously for my family.
Greg Flynn is joining us. He is the fire chief here in West Bloomfield. You're watching the Megacast on Civic Center TV and, of course, on our streaming outlets. And we want to thank the Greater West Bloomfield Chamber of Commerce for allowing us to stream today on their Facebook page. Greg, any news update, anything that you've been dealing with since we talked on Friday that is presenting additional challenges for us, especially here in West Bloomfield?
Dave, COVID-19 is in West Bloomfield, and I can't stress that enough to our residents that it is here. We have identified areas that we see a higher call volume for patients that are calling with their signs and symptoms. We're tracking that in our emergency operations center. We've talked about, I think back to our first interview, and when we said, hey, we need to be prepared. And we are, but that day has arrived, Dave. It's here. And I can't stress to you enough how important it is. All the buildup, all the interviews that we've talked about before, all the social media posts and education that we've been pushing out. Now more than ever, we all need to be doing it. You and I included. We're part of that solution, and the day has arrived. But to your point, some other things to consider, if I may. All of our homes are occupied now. And we want to stress to you, while there's so much focus on the COVID-19, that we also want you to remember good fire prevention things. There's more toasters being used throughout the day and more electronic devices being plugged in, or laptop computers left on beds and plugged into additional power strips. Everyone's competing for Wi-Fi, right? All of these things are happening, and we're conscious of that. We know every home pretty much in West Bloomfield is occupied 24 hours a day now. And that plays a role in the emergency response within our community. I want you to know, and I want the community to know, that we're aware of that and we're prepared to respond to that.
Have you seen an increase in conventional fire and other health emergency type calls? Because we do have more people at home, and when people are at home, there's more people in the community too. Just a numbers standpoint, a lot of people here take off, go to work, but more people are staying close to home. Are your calls up?
So I don't have a definitive answer for that. It feels busy, and the reason why it feels so much busier is because each call now takes more time. So the team, the dispatch team that screens the call, is taking a few extra seconds to do that, to make sure the first responders and the people in the home are safe. Our first responders have some additional time on positively screened COVID-19 patients to don or put on their personal protective equipment. And then after the call, there's a decontamination or disinfecting process that we do inside of the ambulance, because we know that every resident wants the confidence and assurance that when they get inside of the back of one of the ambulances here in West Bloomfield, that it's a safe place. And so all of those assurances take additional time, and it's time well spent, but that is consuming our days. And that's just what we're doing out there with the residents. There's a whole nother level of that inside each of the engine houses here in West Bloomfield to keep the first responders safe while they're in quarters.
Do we have any information here in West Bloomfield? Because you're right, it is here. And you're right, you and I need to be careful. I'm doing everything I can. That's why I'm sitting alone for the most part in the studio. We're doing these interviews via Zoom. I think it's a much smarter, safer way to do it. But do you have any sense of anyone in your departments, or at the police department, or in public service at all here in West Bloomfield that we're concerned that they may have been affected, or any of our staff or anyone has been exposed yet?
Dave, we take every exposure very seriously. We qualify the exposures into a tiered system, and we will always err on the side of being overly cautious with our first responders, just like we do when we're treating our residents in the field. So respectfully, we will respect the privacy of our first responders. And I just want you to know that we are paying attention to that. One of the things we've implemented in each of our engine houses and plan to spread throughout township buildings is the measuring of temperatures 3 times a day in each engine house, each firefighter paramedic. So at the start of their shift, at dinner, and then at the end of their shift, we're watching for any temperature changes, which could be an early indicator of COVID-19 infection.
Well, that makes so much sense, Chief. I appreciate you doing that, and we're obviously don't want to nationally be testing people that we don't think are sick with the virus. We don't have the capability to do that. It would even, maybe even expose more people to the virus that don't need to be exposed. But the temperature thing, a lot of organizations are doing that now. They're measuring the temperature. I think it's a really smart approach. Do you recommend that for other businesses if they can get the equipment?
Well, certainly anything we can do to mitigate risk. And when we pay attention to the signs and symptoms that our body is telling us that there's a problem. And that's just what a fever is, right? So the fever is saying there's something in here that doesn't belong, and we're going to try to cook that out a little bit. And that's one of the first indicators. And then clearly any signs and symptoms of illness, the cough, the sore throat, the shortness of breath, those are all things that we need to each do our part. I know it seems culturally we've always ran out. Oh, I'm just going to run out and get something real quick while I feel this tickle in my throat. We don't want you out. We need you to lean on some neighbor to maybe drop that bag of groceries or the things that you need at the front door. Do the PayPal or something to pay them back. And it's odd, Dave, I look forward to the day that we can sit in the studio together again, and I can walk in and shake your hand and do the things that we've done. But we're a long ways, quite frankly, away from that time returning.
All right, Chief, we'll let you go in a minute. A couple of more quick questions. I know you're busy. So nationally, New York, I mean, they're really having a hard time right there. L.A. having a hard time. We hear the president on TV yesterday saying, well, that's the case in some of those communities. There are other communities where it's not quite as bad. How are we doing here, to the extent that you can share it with us? Do we have the supplies? Are we hanging in there? Are we, we're certainly in better shape than New York. But can you give us a thought on the temperature of our situation right now as it stands?
Well, our residents can rest assured that we are in a good place. Our Emergency Operations Center is forecasting what we're referring to as our burn rate on supplies. Clearly, more symptomatic patients are calling in. That is why I want to reinforce this point. If you are symptomatic and you are compensating well, you're able to tolerate the signs and symptoms, reach out to your healthcare provider, call the nurse help hotline at Oakland County. They will give you some direction as to where to go. Calling 911 is not what we want you to do. If you're not experiencing severe signs and symptoms, we need you to work through the healthcare system in a different way than via an ambulance into the emergency room. And that's a big takeaway from today, Dave. That will help first responders and those healthcare providers on the front lines in the emergency rooms care for those that are most in need. I'm not debating the fact that everyone's in some degree of need, but we're in a real triage situation. It's a French word which means to prioritize, and healthcare providers do it every day. Our dispatchers do it every day on a call. We want to treat the sickest people first, and then everybody else in line when resources are available to help them out. It's again another big ask from the community, but we have to do something different. We can't bombard our emergency rooms and fill them with people just inquiring if they're sick.
All right. Well, Chief Flynn, very well said. Thank you very much for the message. Great job. And before we go, we received your public service announcement that you made with many people in the fire department and across the community reaching out on the coronavirus issue. We're running it. We'll be running it here in a couple of moments. Great. We got it aired on television and radio. Beautiful job. That was really nice. So nice work there. And you look great on TV today. We like the chroma key background with a logo. You guys getting high tech over there with your Zoom casting. Well done.
We like it. We appreciate your support from the team over there at Civic Center TV as well.
All right, very good. We got to run along. Thank you, Chief Flynn. Appreciate you checking in today on the Megacast. So, an awful lot going on here. We're going to take a quick break. We'll be back in a moment. Governor Whitmer's press conference is coming up. We're going to capture that for you and bring it to you live and a whole lot more. So stick around. It is the Megacast right here in 89.3 Lakes FM and lakesfm.com, Civic Center TV, civiccentertv.com, and our partner today on Facebook is the Greater West Bloomfield Chamber of Commerce. We really appreciate them checking in and being a part of the broadcast. I'm Dave Scott here in the studios. Governor Whitmer's press conference coming up in just a couple of minutes. We invite you to stay tuned right here on the Megacast. Don't go away. And Suzanne Levine, you can see her on TV right now. She will be with us in just a couple of minutes after the governor has completed her broadcast, and we'll discuss the impact on the business community here in West Bloomfield. Back in a couple of moments.
Each of us have a role to play in stopping the spread of COVID-19. Keeping a distance of at least 6 feet
will slow the community spread of COVID-19. I can help.
I can help.
I can help by washing my hands.
Using warm water and soap for 20 seconds.
And drying my hands with paper towel multiple times throughout the day.
Be sure to cover your cough using your elbow.
In an effort to prevent the spread of COVID-19.
Avoid touching your eyes, mouth, and nose.
Not feeling well?
Have a fever?
A cough?
Do your part and stay home until you are well again.
If your symptoms are more significant, call your doctor.
Don't drive to the emergency room or show up at your doctor's office.
Without an appointment, that can spread the virus.
In addition to social distancing, avoid crowds.
Even small groups of people can increase the risk of spreading COVID-19.
We know it's hard, but we all need to do our part to stop the spread.
You can get outside and enjoy the parks. There are plenty of trails that are open.
And provide plenty of space for social distancing.
You can call, text, or
chat with friends and loved ones. Hi, Grandma.
You can put together a puzzle.
Or start your spring cleanup.
Or just catch up on Netflix.
We can all do our part to stop the spread of COVID-19.
Hello, it's me, the designer jeans in the back of your closet. What happened to us? I used to summer in the Hamptons, and now I'm stuck behind a pair of sweats. Okay, maybe I never really fit you right, but I got a lot more Sunday fun days left in me. So take me to Goodwill, where I can really make a difference.
Your donations to Goodwill create jobs, training programs, and education assistance for people in your community. To find your nearest donation center, go to goodwill.org. Donate stuff, create jobs. A message from Goodwill and the Ad Council.
It may be hard to believe, but people just like you are already saving money. FeedThePig.org makes it easy. Their simple savings plan teaches you how to start saving without going overboard, so you don't need to sell all your belongings and live in a commune.
These dungarees belong to all of us now, Tom.
You don't need to get a second job as a stuntman.
We need a new stuntman!
You just need FeedThePig.org. Don't get left behind. Get tips and tools at FeedThePig.org. Brought to you by the American Institute of CPAs and the Ad Council.
Jill, why don't you tell the class what you did this weekend?
Well, my dad and I went in search of some magical minnows and found a zillion of them in the stream from our lookout rock. Then my sister and I escaped from an evil slug king and went back to my super twig fort for safety. Then we told stories till it got dark, and the Big Dipper led us all the way home.
Wow. Where were you, Jill?
We went to the forest. It's not that far away.
Ask your parents to take you and your friends to the forest this week. It's closer than you think. Check out discovertheforest.org. Brought to you by the U.S. Forest Service and the Ad Council.
The Cloud Learning Initiative launched on March 16th. The meal service program is kicking off for cloud learners. Pre-order forms and information about weekly menus can be found at www.wbsd.org/mealservice. Pre-order forms must be submitted by 3 p.m. and at the latest the day before. The meal service is open to any family, regardless of city residency, and any child from birth to 18 years of age. Please visit www.wbsd.org/mealservice.
Civic Center TV has gone high definition. Now you can view all of your favorite shows, including our weekly news magazine show The Splash, in even crisper picture than ever before. To watch all of your favorite shows live in HD, visit civiccentertv.com/watch-live. And for more community programming on the road, stay tuned right here on 89.3 WBLD, the all-new Lakes FM.
All right, welcome back. 89.3 Lakes FM, lakesfm.com. I'm Dave Scott. He is Tyler Keefe. So, Tyler, let's get a quick update while we're waiting for the governor here, just what we expect from Michigan, from our local meetings tonight.
Yeah, tonight the West Bloomfield Township Board has a full meeting agenda. That, of course, is posted on wbtownship.org. They'll be discussing regular township business. They'll be postponing some things that need to be postponed, of course, due to this crisis. But they will also be conducting some regular business, as was already planned, including reviewing some cases from the Environmental Commission. They'll be going over some emergency operations that needs to be addressed. And on top of that, they will be confirming their consent agenda as regular.
All right, Tyler, I think we have the governor's press conference here. Doesn't look like they've started yet. I'm going to just bring this up here on our screen. I need your help here, John, just for 1 second, because I've got to get to one of our other controls here. So we'll do that for you in just a minute. And thank you for tuning in. Dave Scott and the Megacast right here on 89.3 Lakes FM. Governor Whitmer coming up here in just a second. You can see her on TV here right now. And I think they're waiting for the television networks to click in, so we'll just leave that there. Tyler, important presentation today. Everyone expects that businesses in Michigan are going to be closing down here with this presentation. Those quote-unquote non-critical businesses. That's what's being reported all over the media.
Yeah, that's been the norm in neighboring states. Illinois shut down last week. Pennsylvania was even earlier on. Last week, just before on Thursday night, before the Kinko Harbor meeting, they made their announcement. So neighboring states have been doing about the same, and I would expect that Governor Whitmer will announce something along similar lines.
Okay, and we're going to be coming to her in just a minute. Our connection might be delayed by a minute or so as this is coming to us via a live stream. Suzanne Levine will be checking in from the Greater West Bloomfield Chamber of Commerce. We'll talk to her after the presentation from the governor and get a little bit more information about what we think will be the impact locally here. We will also be checking in and getting our lunch and whatnot in a couple of minutes, but I think the governor is going. Let's listen in.
Our Chief Medical Executive, Dr. Janae Caldoun. I want to begin by thanking the amazing Michiganders who have stepped up to help others who are suffering in the COVID-19 crisis. During these difficult times, I have seen the best in people. I've seen what makes Michigan so special, and I've been reminded by why I'm so proud to be a Michigander. Since I took office, my administration and I have been committed to lead with transparency and honesty. Obviously, when I took office 15 months ago, neither I nor anyone could have anticipated we would be confronting a global pandemic. So today we have to have a very candid and open, important conversation with you. In just 13 days, we've gone from 0 to 1,232 confirmed cases of the coronavirus COVID-19. It has doubled over the weekend. This virus is spreading exponentially. And in the ordinary situation, if you get sick, you can go to the hospital. We know that the medical team would have the appropriate personal protection equipment like masks and face shields and gowns. They'd prescribe some medicine and you'd be okay. But COVID-19 is a global pandemic. It's a novel virus. There's no cure, there's no vaccine. The only tool that we have to fight it at the moment and to support our healthcare system to respond is to give them the opportunity by buying some time. And let me tell you why that's so important. We have roughly 10 million people in our state. There is a model that anticipates that if we stay on our current trajectory, just like Italy, over 70% of our people could get infected with COVID-19. Of that 7 million people projected, about 1 million of them would need to be hospitalized. Let me give you a little perspective here. We have about 25,000 acute care beds in Michigan. Think about that. That's where we are headed currently. So stopping the spread of this virus is really the most important tool that we have right now to keep our communities safe. That means without aggressive additional measures, more people will get sick, more people will die, and our economy will suffer longer. Without additional aggressive measures, soon our hospitals will be overwhelmed. And we currently don't even have enough beds, masks, gowns, and ventilators. But if we all do our part and simply stay home, we have a shot at helping our healthcare system meet our needs. Because this disease can't spread person to person if we're not out there. So if we work together and we take this seriously, we can slow the spread of COVID-19. But right now, too many people are still out and about unnecessarily. So we must do more. Our problem has been exacerbated because we're still not getting what we need from the federal government. Last week, the president's message to our nation's governors was essentially that we're on our own to handle getting supplies. Let me just put a finer point on that. We just received our allotment from the federal government's National Strategic Stockpile. The allotment of personal protection equipment for one of our hospitals was 747 N95 masks, 204 gowns, 4,467 gloves, and 64 face shields. Now, with the exception of the gloves, that allotment is barely enough to cover one shift at that hospital. Not even a full day's worth of shifts, one shift. So while I can't do overnight what the federal government should have done over the course of months in planning, my team and I are working 24/7 to secure the things we need. So far, we have secured more than 4 million gloves, 4 million N95 masks, and thousands of gallons of hand sanitizer, thanks to Michigan businesses, Michigan companies, Michigan distilleries, and Michiganders who are pitching in. And while that's a source of pride and that is good, it is nowhere near enough. Now is the most crucial time for us to come together to protect ourselves and our families. We must work together to bend the curve. We must do more to curtail community spread so our health system has a fighting chance. Today I'm issuing a stay home, stay safe executive order for all Michiganders, and it goes into effect just after midnight tonight for at least the next 3 weeks. Without a comprehensive national strategy, we, the states, must take action. We are joining a number of other states that have started, and I anticipate many will follow. States like Ohio and Illinois, New Jersey, California, and many others, including New York. We are doing this because it is absolutely necessary to protect the health of our people. The goal here is simple: stay home, stay safe, save lives. This will be temporary. This intervention is important to buy time so we can create surge capacity in our hospitals, so we can ramp up testing and develop therapeutic drugs that may lower hospitalization and fatality rates. Please know that even with today's action, the number of cases will go up yet today, tomorrow, in the days ahead. It will take some time for us to impact this. We will be continually evaluating the data, the science, the impact on our health. It is going to take greater testing. We've made strides, but we must do more so we can understand what the challenge is that we are confronting, so we can draw conclusions based on data. It's been observed, if it were possible to wave a magic wand and make all Americans freeze in place for 14 days, 6 feet away from one another, the whole epidemic would sputter to a halt. It's on all of us to do our part. Our ability to safely lift this order will depend on factors like data on COVID-19 infections and the disease's rate of spread, depend on whether sufficient medical personnel, hospital beds, and equipment exists to meet anticipated medical need, and the state's capacity to test for COVID-19 cases and isolate infected people. I want you to know I didn't make this decision lightly. I've consulted with medical experts from across the country and right here at home, from University of Michigan to Penn to Johns Hopkins to Harvard. Dr. Khaldun and all of these experts recommended today's action, and it is clear this is what we can and must do to protect ourselves. We will all have to make significant sacrifices. By taking this action, we protect our public health and ultimately the hardship on our economy. This is the time we must come together as Michiganders. If we stay home except for essential work and essential needs, we can each be a part of making the difference here. During this time, critical services will remain open. Businesses and operations that do work, that sustains or protects life, can continue to perform that work in person. But in doing that critical work, they must take aggressive steps to minimize the spread of COVID-19 as much as possible. Your grocery stores will be open. I have checked on our whole supply chain for food, and it will be accessible. Do not panic, do not hoard. These services will remain open. Your pharmacy will too, so you can get your prescriptions. Your banks and credit unions. You can fill your car with gas. You can find the full list of critical services that will remain open at michigan.gov/coronavirus. Remember, you can go outside, get some fresh air, walk your dog. Just be smart about it and maintain that 6-foot difference between you and anyone else. And one more thing on the topic of school closures. This order means that our schools will remain closed at least through April 13th. I will have more to say on this subject soon. Now, I know this is hard. I know this is going to be disruptive, and it's certainly going to be hard on our economy as well. But our action will save lives. In the long run, doing this now shortens the time our economy suffers. When we look back at this, we've got to be able to say we did everything we could. On a personal note, I know that the lack of control can be disorienting. So I urge you to focus on what you can control. This crisis can take a toll on our mental health. Check in with family. Call your loved ones. Go for a walk. Read those books on your list, or even go outside and put your holiday lights back up. We must keep our wits about us. That means all of us. Be sensitive to how our kids are feeling. They are not immune from the stress that is going on in this environment. Check in with them and help them understand and give them the reassurance they need. Young people, I'm talking to you now. You're not immune from this. You can get this virus. And in fact, 40% of the hospitalizations and positive cases are among people 20 to 49. You can carry this without even knowing it and be unknowingly exposing others to it. If you don't take this order seriously, we will have to observe these situations longer than we need to. So, to everyone, please be smart. Follow the order. Think about the daughter who has asthma, or the grandpa that has COPD, or the sister who has MS. For the countless healthcare workers who are putting their health at risk to keep all of us cared for. And do it for yourself. We're working to prepare for the long-term economic challenges of this crisis. They will be immense. From unemployment to helping our businesses get back up on their feet. Coming back will take time, and it won't be easy. We're working with the business community to help Michigan businesses and employers weather this unprecedented crisis. And we will keep working around the clock to keep Michiganders safe. Please continue to do your part. Stay home. Wash your hands frequently. Avoid touching your face. Cover your mouth with your elbow or your arm. Stand 6 feet apart from one another. And if you think you should be tested for coronavirus, call on the phone. Call your healthcare provider. Our aggressive action today will help mitigate how many people get sick and how long our economy suffers. I've seen some remarkable things in this time of crisis. This is a test unlike any we've seen before. We are up to it. We will get through this. But be smart. Take every precaution and do your part. Take this seriously because it is serious. With that, I'll hand it over to Dr. Janae Khaldun.
Thank you, Governor Whitmer. We continue to see significant increases in the number of cases of COVID-19 in Michigan every day. As of this morning, as the governor mentioned, Michigan has 1,232 confirmed cases. As of this morning, we also know of 15 deaths. The cases are spread out across dozens of counties across the state, including the Upper Peninsula. It is affecting people across all ages, from the very young, children, to those over the age of 80. We've been preparing and responding for more than 2 months in the Michigan Department of Health and Human Services and with our dedicated leaders across all of state government. We were ready to provide testing in our state lab the day the CDC said we were able to. We have more than tripled the number of tests we can run in our state lab, and we have worked to build a system across the state where other hospitals and private labs can send us their data so we can share it with the public and accurately track cases. Now we can test at least 1,000 people a day, and that number continues to grow. We are also working diligently to make sure we can improve our reporting infrastructure so that everyone can get an accurate picture of the number of negative tests that are being completed in the state. However, we know there are many people who are still unable to get a test. As a country, we did not make tests available quickly enough to be able to fully understand the scope of the problem. We know that there is community spread in several areas of the state. Michiganders have come together to implement the important social distancing measures under Governor Whitmer's direction, decreasing large assemblages and not dining in at restaurants or going to bars. Now's the time, however, where we must do more, and we knew this day would potentially come. If we do nothing, very rough models estimate that the number of cases in Michigan could increase 5-fold in the next week. We are acting right now to decrease that number. If everyone stays at home, if they only leave their home for essential reasons and practice the appropriate social distancing, we will slow the spread of the disease. I'm also a practicing emergency medicine physician, and I've had some very heartfelt conversations with my colleagues across the country over the past couple of weeks. There are ICUs across the country and here in the state of Michigan that are full of dozens of people with COVID-19, all of them on ventilators. Emergency departments are needing to pick and choose who gets to go on a ventilator and who does not. People who were previously young and healthy are now fighting for their lives. Our frontline staff in the hospitals and clinicians are working tirelessly around the clock, taking care of patients with COVID-19 while keeping up with the usual demands of a busy emergency department and a busy intensive care unit. We have to make sure that our hospitals can continue to do this very important work and that they are not overwhelmed with patients who are severely sickened from this disease. These proactive public health measures are aggressive, but they are temporary. And if we all come together to implement them now, I'm confident we will slow the spread of COVID-19 here in Michigan. With that, I will turn it back over to Governor Whitmer.
Thank you, Dr. Khaldun. Be happy to open it up for some questions from the press.
Can you speak to how this executive order will be enforced? Will the National Guard be called at all, or how will it be enforced in Michigan?
So a couple of points. First and foremost, this is not a recommendation, this is an order, and we take it very seriously. This is about the public health of our people. We've ensured that essential services are still available, that if someone needs to go out and get food, that they can do that, and that the food supply chain is robust and prepared to meet the needs of people across the state. We've also ensured that if you need to do banking or gas up your car, you can do some of those fundamental things that are necessary for life. Go and get your prescription. But for any businesses that don't heed this order and are not essential services, I would anticipate that there will be fines associated with not doing that, and they will be shut. We have a moment to stem the crisis that we see unfolding before us. It is going to take all of us to take this action seriously, and that's precisely why this order is so important right now. With regard to questions about the National Guard, they are helping with humanitarian efforts, not on any sort of a law enforcement front, because we've got to ensure that food gets where it needs to be, that we are setting up temporary hospitals, temporary hospital beds, medical abilities to meet the need. And so they are helping in states across the nation, and it's in that capacity.
But there won't be any checkpoints or anything like that on roadways, on highways?
No, this is, at this point in time, what we are asking is that people recognize this is an order that They must comply for their own health, for the safety of others, and for the long-term health of our economy. Any businesses that don't comply, there will be ramifications for it, to be sure. And we have confidence that when Michiganders understand how serious this is, if you really have been paying attention, or if you're now suddenly starting to pay attention, you know that we all have to do our part. And for some of us, it'll look simply, doing your part will just look like staying at home. For others, it'll be staying at home and going online and making a donation to the food bank. For others, perhaps they can call 211 and see if there's something they can do. Checking in on elderly friends and neighbors over the phone or FaceTime. There are ways of coping with this. I'm not suggesting it will be easy, but if we all do our part, and that means business owners too, don't play fast and loose with what is essential and what's not. Don't try to skirt the rules. If you're not an essential business, you need to close, and you need to protect your employees. And we're confident that the vast majority of people are going to do the right thing. And we're imploring those who are maybe still uneducated in how serious this is, that perhaps now they will understand, because this is an order, and this is going to be something that everyone's got to be a part of following.
What about restaurants and carry-out delivery services, things like that? Are those still?
So
okay?
restaurants, the carry-out, dine-out option is still something that is available to people. This is an essential service, which is the feeding of the people of our state. So grocery stores, convenience stores, the pharmacy, the restaurant where you can get your takeout, those will all still continue to serve the public. But we ask the public to, where you can make use of a delivery service, do that. Where you don't have to physically be the one to go out and get it, and there are others who are doing that, make use of it if it's available to you.
Governor, what right line is there for people to use to decide whether or not they're covered by this order?
So I think that as you read the order, and I know you haven't had a chance to scrutinize all the language in the order, but I think it's pretty clear about what services are considered essential and whether or not you fall into that those parameters or not. So I do think that the business community has had an opportunity to give some input over the course of our research and development of this order, and I think that we've made it pretty clear in the terms of the order.
This question is for both of you. You mentioned in your statement, Governor, about thinking of the healthcare workers who are trying to battle this, and there seems to be some inconsistency with the guidelines for those healthcare workers between the state recommendations and the CDC recommendations as to whether they've been exposed to a potential case. They've been asked by the state to keep working, but not to quarantine. So my question is this the safest move for those workers, but also for patients and families tied to them?
I'll have to ask Dr. Khaldun to weigh in on that one.
We have used, for all of our guidance in the state, we've looked first to the CDC guidelines, and we consult with them when we implement our own guidelines. We have to make very difficult choices and make sure that especially healthcare workers who are symptomatic are not at work, period, and that they get the appropriate test if it is warranted, and if they test positive, that they stay at home. So we are actually in alignment with CDC guidelines. We just had to get a little more granular because our clinicians were asking for that guidance.
On the automakers voluntarily cut production at their plants, are they subject to this as well? And how do you account for the ones who are trying to make essential equipment, PPE stuff?
Yeah, so if you're making essential equipment, you are covered in this order in terms of an essential, activity that will continue on. So yes, they are covered by this order if they are retrofitting to meet critical needs of our nation right now, and then the health of our people, then that is an essential service that absolutely would be contemplated and encouraged and permitted under this order.
What are the fines associated with the business who's perhaps violating?
Kathy, the fines, we'll have to give you some more information on exactly what that looks like. I can tell you that the Director of the Health and Human Services Department is the primary when it comes to assessing and writing those. So I think that's, we'll have to give you a little more information when we have a moment.
Governor, you touched on this, but what changed or occurred or didn't occur to make you ramp up the earlier, basically, advice as opposed to an order with consequences?
Well, a couple things. First of all, exponential growth. We know that we are not capable of testing everyone who needs to be tested because we don't have enough tests from the federal government. Despite that, we've seen exponential growth in the number of presumptively positives. We know the trajectory that we're on, and I've talked to Dr. Khaldun and experts across the country, and it became very clear that our healthcare system is quickly going to get overwhelmed. And without the support of the PPEs and all of the other essential pieces of protection that we need, and the resources and the bandwidth for our hospitals, we have to be aggressive in curtailing the community spread. And it's by keeping people away from each other. It's what we know is that there still are gatherings happening, that there still are people that are out and about conducting their lives as though we are not living in the midst of a global epidemic. We don't have beaches that are open right now, but we all saw the footage, and I can't for the life of me figure out why anyone would want to congregate in this era. But the fact of the matter is we still have people that are doing it, and that's why we've got to be really clear about the seriousness of this and put the full weight of an executive order behind it. So these are all different pieces of it. But I'll tell you, the current trajectory we're on looks a lot like Italy. And if you've seen any of the coverage about what's happening in Italy, what it means for their economy, but most importantly, what it means for the lives of the Italian people, you know we've got to do everything in our power to keep that from happening here in Michigan. And I shared with you one anecdote about younger people being as susceptible as older people. There's been this misperception that if you're young, you're not susceptible to COVID-19. The fact of the matter is, in America, we are seeing severe consequences in our younger people in ways that they haven't seen in other parts of the world. And I've talked to more than one physician who has observed, and perhaps, there's too little science to know precisely if this is what's going on, but vaping is a lot more popular in the United States than it is elsewhere, and that compromises your respiratory system and makes you more susceptible to respiratory illness. And so this is a crisis that we are feeling in ways that other parts of the world hasn't even experienced.
Regarding elections, this order goes into April, but we're wondering if May elections may be impacted by this, if you think they should be postponed?
So we are working with the Secretary of State as well as the legislative leaders to assess if there are ways that we can improve the ability for people to cast their votes at home. That's a conversation that's been started. I would anticipate that it will take on, additional energy this week, and we may have something to share with you later. Yeah, we want to make sure people are able to vote and to vote safely.
Are temporary hospital structures going up? Are you looking at dorms, things like that, to deal with this? And the question on ventilators, I think earlier or over the weekend, you said that there were 1,000 across the state. I'm wondering if all of those are being used and what kind of shortage we're facing at the moment.
All right, we have teams that are actively looking at just this question of where are we going to need this hospital capacity, not just in some of the areas where we're seeing the most cases, but we have to come together as a state, understand where our hospital beds are and where we may have more need. So that plan is being developed as we speak. As far as the ventilators, we do need to get I think a stronger handle on more real time what the situation is on the ground in these intensive care units. But I can tell you, at least from anecdotal conversations across the state, we are getting very, very sick people, and our intensive care units are getting filled up.
And do you have any figures as to how many people are hospitalized with this now? Is that a number that you're tracking? Is it a number you're going to be putting out at some point?
We are actively trying to track that. Here in the state of Michigan, we have a decentralized public health system, so a lot of the local health departments actually are able to track that in more real time than we can at the state, but we are actively working to strengthen and centralize data sharing from the hospitals to the local health departments and to the state of Michigan Health Department.
But we don't know what that number is or is close to right now?
I don't have the specific number right now. There are dozens of people who are, at least dozens of people who are in intensive care units as we speak. I don't want to misspeak and give you a wrong number, but I know there are several individuals, dozens, who are hospitalized at this point.
Just one question. Over the weekend, the task force, the federal task force, has been giving briefings and letting the American people know where they stand on things and what their responsibilities are versus, the state. So I'm wondering what your response is to some of those comments that were made over the weekend about the responsibilities that states have to find those resources, such as the ventilators, the PPE, versus the federal government's responsibility.
Well, we can litigate what contributed to us all being behind the 8 ball in the United States of America right now, after we get past the initial crisis that we're confronting. I will just say this. Our national stockpile allotment covered one shift at a hospital. So where you would ordinarily, in a crisis like this, expect a national strategy that covers all of the states and all Americans and makes available the necessary equipment to treat people who are sick, we got enough for one shift. It's a source of frustration that I've been clear about and that my, frankly, colleagues from across the country have as well. We should be able to rely on a national strategy and planning. This is not something that wasn't known at the federal government level many months ago. But relitigating that and spending energy on it right now doesn't solve the problem, and that's what I'm going to stay focused on. And that's why my team and the State Emergency Operations Center is working so hard with Michigan businesses, with businesses outside of Michigan, to procure the masks and the face shields and the gowns and all of the different pieces of equipment that are necessary so that we can treat people. That's why the healthcare situation is so dire, and that's why taking an aggressive action like stay home is so crucial to our ability to meet the needs of our people. And so we're going to continue doing that as people who are listening, who are paying attention, have been reaching in. We're grateful for that. We've been able to do a lot because people have offered to help. And where there's additional opportunities like that, we are going to avail ourselves of it. Because at this point in time, I think the governor from Illinois said it. It is governor versus governor trying to get as much as they can for our states. It shouldn't have to be that way. If the federal government had done some planning on the front end, we would be in a lot better shape. But here we are, and we all got a job to do for the people that we serve. I'll just conclude with this. Tough times don't last, but tough people do. Michigan and this country has been in crises before, and we've called on our countrymen and countrywomen to step up to the challenge to meet the need. And Michigan played a huge part in winning World War II as the arsenal of democracy. Right now, we are calling on everyone to do your part. We need to get through this crisis together, and we need everyone to do their part. So we're asking, stay home, stay safe, save lives. That's the most important thing that we can all do right now. Observe these orders, take care of yourself, and stay home.
Well, there you have it, Governor Gretchen Whitmer joining us live here on the Megacast. I'm Dave Scott. Wow, quite an announcement. We're going to dissect all that and talk about the impact on our business community with Suzanne Levine, the executive director of the Greater West Bloomfield Chamber of Commerce. We'll check in with her in a couple of minutes. Briefly recapping what the governor said, I thought the most striking thing she said was in the Q&A, where she said our current trajectory that we are on looks a lot like Italy. There is a sobering thought for you. So we have a stay-at-home order that goes into effect at midnight tonight. Critical workers will continue to work. The rest of us are going to do everything we can to stay at home, with the exceptions that have been outlined by the governor. Governor said cases doubled over the weekend, and the only tool that we have really is a tool of buying time. On the current trajectory, 70% of the people of our state will get the coronavirus. Another sobering thought, and that means 1 million people hospitalized. So they're doing all they can to level the curve right now and not let that happen. And her slogan for all of this, stay home, stay safe, save lives. There is a stay-at-home order here in the state of Michigan, goes into effect midnight tonight. We'll talk more about it over the next couple of minutes, and we thank you very much for joining us here. It's a tough day, but we're here all together. This is the Megacast on 89.3 Lakes FM, lakesfm.com, Civic Center TV, civiccentertv.com, and we want to thank our good friends at the Greater West Bloomfield Chamber of Commerce for making their Facebook page available for this broadcast today. We'll take a break, and we'll be back in just a couple of minutes. I'm Dave Scott for Civic Center TV. We'll be right back.
Each of us have a role to play in stopping the spread of COVID-19. Keeping a distance of at least 6 feet
will slow the community spread of COVID-19. I can help.
I can help. I can help by washing my hands.
Using warm water and soap for 20 seconds.
And drying my hands with paper towel multiple times throughout the day.
Be sure to cover your cough using your elbow.
In an effort to prevent the spread of COVID-19.
Avoid touching your eyes, mouth, and nose.
Not feeling well?
Have a fever?
A cough?
Do your part and stay home until you are well again.
If your symptoms are more significant, call your doctor.
Don't drive to the emergency room or show up at your doctor's office.
Without an appointment, that can spread the virus.
In addition to social distancing, avoid crowds.
Even small groups of people can increase the risk of spreading COVID-19.
We know it's hard, but we all need to do our part to stop the spread.
You can get outside and enjoy the parks. There are plenty of trails that are open.
And provide plenty of space for social distancing.
You can call, text, or
chat with friends and loved ones.
Hi, Grandma.
You can put together a puzzle.
Or start your spring cleanup.
Or just catch up on Netflix.
We can all do our part to stop the spread of COVID-19.
Dave, what are you doing?
Just sending a gift to Dave 2037.
Who?
Me in the future. I save a little money from every paycheck as a gift to Dave 2037, so he can spend it on things like anti-gravity boots or a hologram Doberman, something cool like that. I think Dave 2037 deserves it. He worked hard. What are you getting Steve 2037?
I guess I was thinking Steve 2037 would just fend for himself.
Well, all right, but don't expect to be borrowing my anti-gravity boots.
You want to have money in your future? You got to start saving now. Putting some money from every paycheck into a savings account or contributing to your 401k can make a big difference later. Put away a few bucks, feel like $1 million. For free ideas and easy ways to save, go to feedthepig.org. That's feedthepig.org.
Hey, let's just hope Steve 2037 doesn't get his hands on a cool time machine, because he is going to come back here and knock some sense into you.
This message brought to you by the American Institute of Certified Public Accountants and the Ad Council.
All right, welcome back to the Megacast right here on 89.3 Lakes FM, lakesfm.com, Civic Center TV, civiccentertv.com, and we want to thank our good friends at the Greater West Bloomfield Chamber of Commerce, Suzanne Levine, who I think is going to join us via Zoom here in just a moment, and we want to thank them for making their Facebook page available today for further expanding the broadcast. We'll have a Facebook partner with us every day here on the Megacast. So, wow, quite an announcement from the governor as she announces her stay-at-home order. We'll dissect this through the balance of the broadcast, but let's quickly get feedback from Suzanne Levine. She is the Executive Director of the Greater West Bloomfield Chamber. Suzanne, are you there with us on Zoom?
I am here.
There we are. Hi, Suzanne. So I assume you heard the governor. What are your thoughts?
Well, I really don't think there's any new information.
You know, Suzanne, I can barely hear you. If you can get a little bit closer to your microphone, maybe we'll be able to hear you just a little bit better. Are you there now?
Yeah, can you hear me now?
Yep, that's a lot better. Thank you.
Okay, great. I don't believe there's a lot of new information. I think basically we knew that most of the non-essential services were going to be closed. I know that a lot of the dentists, etc., have been told, to stay closed unless it's a case of emergency. I think basically saying it's an order, maybe it'll have more impact on people. I don't know what the consequences are for not adhering to this. I don't recall that you said that there were any at this point.
All right, Suzanne, we're having a little difficulty hearing you, so we're gonna connect back with you in a couple of minutes, and I apologize for that. It is a little bit hard to hear from you, but while we're working on doing that, and we are also hopefully going to talk to local musician Steve Acho, who is also standing by. Why not a little music in the middle of all this difficulty? We'll talk to him in a couple of minutes, but I just want to take a brief moment again to recap what the governor said today, and then hopefully we'll have a chance to check in with Steve here in a moment. Maybe we can get Suzanne back on the phone for a minute or two, and as the Skype is not working really well. The governor said that our cases have doubled. Our cases have doubled in the state of Michigan over the weekend, and we just need to buy time. On the current trajectory, 70% of the people of Michigan will be affected, and she said it was absolutely necessary for people to stay home, stay safe, and save lives. The stay-at-home order is online. Tyler Keefe is here, gave me a copy of it, and Tyler's going to get this on our website, but you can also read the order directly for yourself. It's at michigan.gov/coronavirus, and in briefly reading through the order, it essentially says that essential businesses will continue to operate, and as a communication tool that's connected to government, Civic Center TV and the Megacast will go on. But other industries and other businesses are going to close down as of midnight tonight, and there are some exceptions and details in here. But for the most part, if you're not running a gas station or a restaurant where people are getting food, or a pharmacy or some other essential business, if you're involved in the manufacturing of goods that are essential, if you're involved in any part of the supply chain, you're going to want to continue to keep things operating there. But other than that, it's time to stay at home, and it's time to shut down our businesses, and the governor said this will be enforced. So I'm sure a lot more is going to be coming out over the next 24 to 48 hours as to exactly how this will be enforced. But if you want to read the rules again for yourself, and I recommend that if you're a business owner making decisions on whether your employees are going to come to work, whether your door is going to stay open or closed, that, again, you go to michigan.gov/coronavirus. We're going to take another quick break. We will be back in a moment. I'll see if I can get just a few more comments from Suzanne Levine on the phone, and then we'll check in with our good friend Steve Acho, who I don't think we've seen Steve. I can see Steve on TV there. Hi, Steve. Can you hear us real quick? Yeah, we'll come to Steve in a second. I can see it. We can see at least Steve on TV. And hopefully we'll be able to get a song in with Steve and find out more about his live streaming Facebook concert tonight at 6:30 online. We'll be back in a moment. This is the Megacast on 89.3 Lakes FM and Civic Center TV.
Health concerns in high school sports go beyond physical injuries. The mental well-being of our young people is a hotter topic than ever before. The Michigan High School Athletic Association website has resources to help adults and students recognize potential problems and deal with them in a positive way. You can learn more about these mental health resources on the Health and Safety page of the MHSAA website. A message from the MHSAA promoting the value and values of educational athletics.
The Cloud Learning Initiative launched on March 16th. The meal service program is kicking off for cloud learners. Pre-order forms and information about weekly menus can be found at www.wbsd.org/mealservice. Pre-order forms must be submitted by 3 p.m. and at the latest the day before. The meal service is open to any family, regardless of city residency, and any child from birth to 18 years of age. Please visit www.wbsd.org/mealservice.
Smoke alarms can save lives, but only if they work. They don't last forever and must be replaced according to the manufacturer's recommendations. If your smoke alarm has been in service for more than 10 years or is beyond the expiration date, then it should be replaced. So pay attention to those dates, and please know that replacing outdated alarms today may save you and your family tomorrow.
A public service message from the Michigan Bureau of Construction Codes.
Did you know that the annual average temperature of the United States has increased by 1.8 degrees Fahrenheit over the period from 1901 to 2016? That may not sound a lot warmer, but think about the United States as you would your body. The average temperature of the body is supposed to be around 98.6 degrees Fahrenheit. Living with a temperature of 1.8 degrees warmer would mean living with an 100.4 degree fever at all times. Over the next few decades, annual average temperatures are expected to rise by about 2.5 degrees Fahrenheit for the United States. Just like an untreated fever would negatively affect our bodies, rising temperatures will negatively affect the Earth. Go to eos.org to find out more about climate change. This message is brought to you by 89.3 Lakes FM and the WBHS Digital Media Arts program.
Today in school, I learned a lot. In chemistry, I learned that no one likes me. In English, I learned that I'm disgusting. And in physics, I learned that I'm a loser.
Today in school, I learned that I'm ugly and useless. And in gym, I learned that I'm pathetic and a joke. In history, I learned that I'm trash.
Today in school, I learned that I have no friends. In English, I learned that I make people sick. And at lunch, I learned that I sit on my own because I smell. In chemistry, I learned that no one likes me.
In biology, I learned that I'm fat and stupid. And in math, I learned that I'm trash.
The only thing I didn't learn in school today?
The only thing I didn't learn today.
The only thing I didn't learn
is why no one ever helps.
Kids witness bullying every day. They want to help, but they don't know how. Teach them how to stop bullying and be more than a bystander at stopbullying.gov. A message from the Ad Council.
Each of us have a role to play in stopping the spread of COVID-19. Keeping a distance of at least 6 feet
will slow the community spread of COVID-19. I can help.
I can help. I can help by washing my hands.
Using warm water and soap for 20 seconds.
And drying my hands with paper towel multiple times throughout the day.
Be sure to cover your cough using your elbow.
In an effort to prevent the spread of COVID-19.
Avoid touching your eyes, mouth, and nose.
Not feeling well? Have a fever? A cough? Do your part and stay home until you are well again.
If your symptoms are more significant, call your doctor.
Don't drive to the emergency room or show up at your doctor's office.
Without an appointment, that can spread the virus.
In addition to social distancing, avoid crowds.
Even small groups of people can increase the risk of spreading COVID-19.
We know it's hard, but we all need to do our part to stop the spread.
You can get outside and enjoy the parks. There are plenty of trails that are open.
And provide plenty of space for social distancing.
You can call, text, or
chat with friends and loved ones. Hi, Grandma.
You can put together a puzzle.
Or start your spring cleanup.
Or just catch up on Netflix.
We can all do our part to stop the spread of COVID-19.
All right, welcome back. Civic Center TV, Lakes FM, the Megacast. I'm Dave Scott. Tyler Keefe in the studio with us now. And, wow, I mean, just, I almost don't know how to react to having every non-essential business in the state of Michigan shut down. We knew it was coming, Tyler, but now that it's here with the impact hitting tonight and all these businesses closing down, and then, Governor Whitmer in a press conference talking to the media saying that this is like Italy. Let me find my notes here with the exact words. I want to get that quote directly. There it is. The current trajectory that we are on looks a lot like Italy. I mean, that's a sobering thought.
It is, and it's been exponential growth in Michigan, and it's had a major spike in the last week or so here, and so in that sense, it is looking like Italy, and it's just it's an odd reality that we've never faced before, to have the entire state effectively being shut down. I mean, other than essential services and whatnot, it's something that is truly historic that we've never experienced before as a state, as a society, and hopefully once we weather the storm, never experience again.
Well, and hopefully we will weather the storm and things will start to get a little bit better. No one can make any forecast of that. And in fact, the governor said that the schools will be closed through April 13th, but she'll have more info soon. So I think we can expect that we're going to have an extension of what the school closing has been probably through April into May. And I think most people right now, at least I can only talk to my experience, are saying, okay, I'm okay with dealing with this, but can you give me some idea what the end date of all this is? I mean, we all want such a clean resolution. What's the end date? Is it, and I think we've kind of been sold maybe May, but I don't know how realistic that is right now.
Yeah,
so we'll have to see.
And I'm no expert on this either, but I think that part of the motivation behind these precautions that the governor took today and that other states have taken is to further limit the exposure that people have to others in society, so that we can continue to track where this virus is spreading, how it's spreading, and hopefully get as far in front of it as we can possibly get, which will definitely help with flattening the curve and hopefully buying us some time to figure out how we as a state can best treat this.
All right, so the other big sobering issue locally today, and sobering comment, came from Chief Greg Flynn, who said, Dave, today is a different day than we started doing these interviews a week and a half or so ago. He's checking in from the fire department today, and he says the coronavirus is here in West Bloomfield. I don't think that was any big surprise, but to hear it right from the one of the top officials who's on the front line of all this in West Bloomfield, that was a little sobering as well. So we're like Italy, and it's here in West Bloomfield. I don't want to be over dramatic, but folks, stay home. The words from the governor: stay home, stay safe, save lives. So we will work on the interpretation of all this. I can tell you right now that Civic Center TV is an essential service. We are communicating. We are connected to government. We're going to make sure that we do all that we can to keep government available for you, but we will do so in a way that is safe, and we will comply with all the regulations that are right here in this order. We just got to read them and make sure we understand what they all are. So we'll do that. All right, so just a couple of housekeeping things. I do want to end this on an upbeat note. So Steve Acho is standing by. We're going to go to him in just a minute, and maybe we can end with a little bit of music. But we're hard at work. Go to civiccentertv.com/coronavirus. You will see the Carryout Club, which I think is very important, at civiccentertv/carryout. We'll be working on promoting the Megacast around the community, doing so in a safe way. So look for all these things and continued updates, and we'll have a very full broadcast tomorrow. If you missed the governor's presentation or anything we've done earlier, stay tuned, because it will continue to repeat throughout the day right here on Civic Center TV. All right, let's cross your fingers, Tyler. Cross your fingers that this is going to work. Let's go to Zoom now and see if we can connect with Steve Acho. Steve, are you there? Steve, can you hear me? Okay. So
they may not be able to hear us, Dave.
Try one more time. Steve, can you hear me? All right. So we'll try that tomorrow. Good job by the technical team. Not all the buttons and dials. We've got wires running all over the studio here, and it's worked most of the time for the most part, but it isn't perfect. So just to recap a couple of things. First of all, on the meeting front, we at Civic Center TV want to continue to give you great access to what's going on governmentally. So we certainly want to make sure you're aware of what's going on. So we have two meetings going on tonight. One of them is going to be our West Bloomfield Township Board meeting, and then the West Bloomfield Schools meeting. Both of them will be done via Zoom, Tyler.
They will. They'll both be done via Zoom. They'll both be televised on our television channels and on our stream. So West Bloomfield Township Board at 6 p.m., Civic Center TV, Comcast Channel 15, AT&T 99. Online, civiccentertv.com. You'll click on Watch Live, and it'll be right there. The school district, that meeting, the Board of Education meeting, 7 p.m. That will be on WBTV, Comcast 19, AT&T 99, and online, wbtv.wbsd.org. You'll click on live stream.
And I imagine if you go to the school district or the township website, I've not talked to the folks there during the day today. We've been busy working on the broadcast, but I imagine they'll have information there on how you can link to these Zoom meetings. And I can tell you, in the case of West Bloomfield, if you're going to interact with Zoom, you'll be able to do so with the Zoom application. So you just got to figure out how to get into the Zoom application. And then you'll be able to ask your questions and participate theoretically, if everything goes well, theoretically just like you would in any other meeting. And I think the same will be true of the school district.
Yeah, and the school district's PR expert, Dan Durkin, has been hard at work working on a way to make sure that public comment continues to be as effective and efficient as possible for tonight's school board meeting.
All right. So should we try one more time?
You know what? I think it's in our best interest to try.
All right. Steve Acho he's been standing by the whole broadcast. Let's see if we can get him one more time. Steve, are you there?
Yes, sir.
There we go. We got you. West Bloomfield musician Steve Acho. Now, Steve, we got you live on TV. Thank you for joining us. Sorry about all the technical difficulties. This isn't easy. Have you ever been on like the television and radio and Facebook via Zoom before?
Oh, yeah, absolutely.
Okay, so you tonight have your own Facebook Live broadcast. Tell us about it.
Yeah, that's right. I heard from a bunch of fans over the last several days. It wasn't even, are you going to do a live stream? It was, when is your live stream? So I guess I'm obligated to do it, and it sounded fun. And since we're all boarded up anyways, I thought I would open up the laptop and stream a concert. So I put it out there on Facebook and already have a bunch of requests. So my friends and fans have written the set list, and there'll be a few silly Corona parodies and a bunch of other stuff that people requested. So
you're going to do some coronavirus parodies tonight, then, is what you're saying. All right.
Well, I'm surprised that, what's his name, isn't on this already. Weird Al should be on it with My Corona or something, but there's a few good ones out there, and I'll try and make people laugh.
Maybe we should call up some folks, and maybe we should do like our own version of West Bloomfield Saturday Night Live or something, and get a couple of people in the studio 6 feet apart from each other.
Live.
Yeah, I don't know. Steve, I'm sorry we got to you so late in the broadcast, but you're right there at your piano. We got about 2 minutes. Is there anything you want to do for us?
Yeah, sure. Here's one of the silly ones that's out there that I think people have heard, but one of the parodies is, oh, I'll tell you something about understands. If you don't want the virus, you better wash your hands. You better wash your hands. You better wash your hands.
I love it, Steve. It's great. So you got a bunch of those?
Got a handful of those, and then Kenny Rogers just tragically passed away.
Yeah, that is so sad.
I've got requests for The Gambler, all kinds of stuff. So
all right. So you realize you scheduled your Facebook Live tonight right during the middle of our West Bloomfield School Board and Township Board meetings. But that's okay.
That out. I'm so sorry.
That's
just
all right.
found that out.
That's all right.
I apologize.
People are going to have to make their own choice. So listen.
Actually, they don't have to make a choice, because even though it's live, you don't have to watch it live. You can watch it later, right?
Oh, that's true. You can go to your Facebook page later, and it'll all be archived on there.
Brave new world.
All right. Listen.
You can say and not or.
I like that. Steve, let's figure out a way to get some of this stuff recorded. So if you don't mind, I'd love to have some of your coronavirus melodies that you've made. Maybe we can get them on the radio and figure out a way to do that other than Zoom, okay? So we got to figure out a way to do it.
You bet.
Now, you can't see it, but our audience can see it right here in my hands. Is the multi-page order from the governor telling us to stay at home. I know you're at home right now, but we'll have to figure out a way to do this that complies with all this. But I know we get creative. We can figure out a way to make that happen, and I applaud you.
Yeah, I can record an audio or a video from home. I don't have to go anywhere, so that's fine. I'll comply. Don't worry.
Steve Acho, my brother, thank you so much for checking in. Good to see you. Thank you so much. All right, sorry we're tight in time. We'll do it again real soon. So there's one West Bloomfield musician in person really making a difference, trying to brighten up everybody's lives, and a great way to end this edition of the Simulcast, Tyler.
Yeah, Steve's doing his part. He's doing his part as best as he can, staying home, staying safe, but still providing great entertainment to the people of our community.
The Beatles, I want to wash my hands.
Fantastic.
I love it. All right. Well, hey, that's going to be it for the Megacast today. A lot more going on. Now, remember, stay tuned to Civic Center TV and Lakes FM. This is going to continue to rebroadcast throughout the day into tomorrow morning until we're back together again live again at 10 o'clock tomorrow. So we invite you to stick around for that. Tune in to Steve's broadcast tonight, Steve Acho on Facebook. And you can do that at 6:30. Of course, we'll have our 2 meetings tonight, and we'll be back here again tomorrow. Stay tuned throughout the day for repeat broadcasts, and stay safe. It's a crazy time, but we will get through it together. Tyler, thank you very much. Good job today.
Thank you.
Extend my thanks to the entire crew.
I will.
And for those of you, thank you very much for listening. This has been the Megacast on Civic Center TV, civiccentertv.com. A big thanks to the Greater West Bloomfield Chamber of Commerce for participating with us today and offering up their Facebook Live. And, of course, thank you for listening on the radio right here at lakesfm.com and 89.3 Lakes FM, WBLD, Orchard Lake, West Bloomfield, Keego Harbor, Sylvan Lake. Lunch with Larry's coming up.